Hello everyone, and today we are going to be talking about legally required benefits. So Chapter 9 were the discretionary benefits, and Chapter 10 are in fact legally required. So we'll start with Social Security. What is it? What was the purpose of Social Security? And these are really programs that are designed to help people who have become unemployed for whatever reason, or are disabled, that they will not become destitute. Okay, so we just want to make sure that people can continue to pay some of their bills, to get some food, to have a roof over their heads. All these things are good for the economy, so we want to make sure that we continue to do this. Obviously, it's good for the human being perspective, but it's also good to make sure that people have the opportunity to purchase things in our economy. And then why was it necessary to enact workers' compensation? So workers' compensation has to do with when an employee becomes injured at work, somebody's got to pay for that. Okay, so workers' compensation really came into existence pretty early on in the 20th century, 1910, 1920, and it was because there was a lot of industrialization going on and people were having those industrial accidents and illnesses, and so this was just a way that the federal government could come in and help to make sure that these people were protected from these employers. And the big shift in healthcare was about 10 years ago. So some of you may remember it, some may not, but that was when Barack Obama and his administration put forth the PPACA, also known as Obamacare. And that made healthcare legally required for all employers to provide affordable health care, but just for every individual in the United States, they were legally required to have health care insurance. All right, that was a big shift because in the past, as we learned about in the last chapter, one of the big benefits that first came about that were discretionary benefits were health care. So this is just a different shift. All right, so unemployment insurance. That's where we are right now. I've got a slide here in a second that shows the current state of unemployment. But what it is when people become unemployed through no fault of their own. So they're laid off, they're furloughed. It's not due to poor performance. You can't get unemployment insurance because you're a bad employee. But if you are laid off, then you have the right to have unemployment insurance. And it's a really interesting how it gets administered. So it's kind of a combo between the states and the federal government. So each state runs their own unemployment insurance, and they administer that, but it's within certain federal parameters. Okay, so it's financed by both federal and state taxes that are levied on employees, but it is, again, I've been reading each of you answering that question on the Ed Puzzle, and each state has their own way of calculating those weekly unemployment benefits. And so it is state run, state administered, they gather the funds, but it's within these federal parameters, and then the federal government actually invests that money. And then what is OASDI? Old Age Survivor Disability Insurance. And so what is that? So it's kind of, the old age is retirement, survivor, their survivor benefits, disability benefits. So what is somebody who is fully insured? It is somebody who has worked for 40 quarters or 10 years, and they have to be paying into that Social Security system during that time. at what age will you collect full Social Security benefits? Trick question. So if you were born before 1960, and I'm going to guess that none of you were, then it's 65. But starting in 2022, it's going to be 67 years old. So anybody born in 1960 and above, they need to be 67 if they want to collect full Social Security benefits. Okay, you can be 62 and collect partial, but you want to be 67 if you want to have those full benefits. And then just as a FYI, the fun fact is what was the average life expectancy in 1935? And I will just tell you, it was 61.7 years old. So that's how they came up with that number, that you could start taking out partial at the age of 62. I'm going to let you guys Google our current life expectancy, but I'm going to tell you, it's quite a bit higher than 61.7. All right? So where are we with unemployment insurance? So we've got 6.6 million more workers filed for unemployment with that week ending April 4th. And so the 3-week total since March 15th was nearly 17 million workers, and we expect that there's really going to be even many more millions of people out of work due to the pandemic. Something else that I found interesting was an article that was posted in the state of Washington, in the Seattle Times, and it showed that there are certain people who actually will make more money in the 4 months that they collect unemployment in the state of Washington, thanks to the additional $600 a week that the federal government is kicking in. So it's the state benefit plus what the federal government, that $600. And so basically anybody making less than $62,500 right now for the next 4 months until that July 25th will actually make money. They're going to earn more than if they were working. But again, that's really dangerous, right? Because that money will run out. And again, these are state run, but most states will allow for about 26 weeks or half a year worth of unemployment benefits. But this is such an unprecedented situation. This could change. It could go from 4 months of that extra $600 to 6 months or to longer. I'm not sure. I know that Congress is looking into these things. So what is Medicare? Medicare falls again under these social programs, but it is separate from OASDI, and it serves citizens who are at least 65 years of age or older. And there are different parts, as you can see, to Medicare. Part A is mandatory hospitalization. So mandatory, compulsory hospitalization insurance. Part B is voluntary, and it's medical. So it'd be like going to the doctor for your routine visits and checkups. Then you have Medigap, which is kind of like Aflac. So Medigap pays for those things that aren't covered under the Medicare Part A and B. Okay. Then you have Part C. Now Part C is an alternative to A and B. Okay, so it's a combination of the hospitalization and the medical, but it's more, you have a lot more variety of options. So it's more of this private insurance companies as opposed to the federal government, and their managed care programs. You can have your managed savings accounts like we'll talk about in a bit. And then there's Part D. Part D is prescription drugs. What is the donut hole? The donut hole refers to prescription coverage, the prescription drug coverage, and it is a gap. And I've got a slide that I'm going to show you next to talk about that a little bit more, so you can kind of see why that was such a big deal, but it's not such a big deal now. And then what is the taxable wage base. Now that limits the amount of annual wages or payroll cost per employee subject to the taxation for your OASDI. And in 2020, that cap, and we'll do a crunch the numbers that'll show you a lot more clearly what that is, but the cap in 2020 is $137,300. I'm sorry, $137,700. All right, so let's talk about the donut hole. Medicare Part D, over here on the right, okay, this is what senior citizens, and again, that's why this is so imperative that we get this right, because our senior citizens are very vulnerable citizens, or many of them are very vulnerable citizens because they just don't have a lot of discretionary income. They're on a fixed income, so they don't need to be spending just a lot of money. However, they are older and they do tend to have more prescription drugs. All right. So the way that insurance program works is that the insured person, the enrollee, is going to pay 100% of that first $435. That's just a deductible, just like any other insurance plan. Okay, so you're going to pay 100% up to that $435 for your prescription drugs. Then this initial coverage says that, again, the enrollee, the insured person, is going to pay 25% of their prescription drugs, up to a total of, where their drug total is up to $4,020. That means that the plan is going to pay 75%. Okay, so here, this is the coverage gap, and here is where that donut hole used to be. Okay, so now the way that it's structured is that the insured still is going to pay 25%. All right. So they're going to pay 25% of their drug costs. This is what's new and interesting, is that the manufacturer, the drug manufacturer here, has said that they are going to take on part of this payment. So they pay 70% of the drug cost, and then the plan pays 5%. But you can see, if the drug company hadn't been here, then the senior citizen was going to be paying a lot because the plan wasn't paying hardly anything. And this is a big gap that the senior citizens were having to pay. And then once they reach this catastrophic coverage level, they pay 5% for the rest of the year. The plan pays 15%, and Medicare then kicks in the next 80%. Okay, and that's that Medicare, which would again be like Part B, or Part C would be this 80%. Okay, so that's what we're talking about there. Now let's do crunch the numbers next.